Guys, I'm here today with Stephen Thomas. He is a personal trainer here in the UK. He has a delightful YouTube channel. I suggest people follow that channel after this video. He's got experience in phlebotomy, which is quite interesting, and he has specialism in managing obesity and diabetes. He also, you can tell by the background image there, he's a bit of an expert in regards to spinal health. So I hope we can cover that topic as well today. So, have I missed anything, Stephen? Does that cover who you are in the gist?
Yeah, I'm a nice guy, and I have a honours degree in science, in physiology and health sciences, which I'm not overly bothered with labels, to be honest, but it does help some people feel comfortable. And I did all the qualifications in diabetes and obesity, and did what, well, you'll know because you're in the UK, that a GP referral sort of thing, to be able to be on a sort of list that GPs can feel confident to recommend you. So you learn all about the medications, and you learn about the contraindications and what you should do. Unfortunately, obviously, you're trained in mainstream thinking, but it's a good base. And I think the phlebotomy, I mean, I could have worked with the NHS taking bloods and stuff like that. I did it for a private blood test because so many people ask, can I have, this panel, that panel? And I got really fed up with clients saying, well, my doctor doesn't want to do reverse T3. My doctor doesn't think you need to do antibodies or whatever. So I went and got trained. I mean, one of the things I always say to people is just, to keep yourself open-minded and research as much as possible. And it's one of the best things I did, because nothing beats actually taking somebody's blood, then getting the results, and you have a doctor's report as well with it, and going over the results and seeing the truth about what certain things actually mean, rather than the interpretation. And I think that's been something that has really helped me with the online coaching, to be honest. And I want to thank you actually for having me on here, because you're quite new to YouTube. And I've watched a couple of your videos and I think it's great. So I'm really glad that it's going well for you.
Thanks, Stephen. I appreciate that. Yeah, I've been at this now for about 6 weeks. I've since got a green screen behind me, speakers, microphones, all the webcams and gear and that.
Mhm.
It's costing a small fortune, but that's how it goes. I am intending to get better quality videos up at some point, just on a side note, but it's all coming together nicely. So expect for a year from now, expect much better videos, basically. Um,
Mhm.
much like yourself, I mean, you're by the looks of things getting more into it more frequently now in terms of your YouTube channel. You've had it for quite a few years, but you've got a great subscriber count, so people obviously like what you put out. So good job.
Yeah, thank you. I feel my hand was forced because the restrictions, before the restrictions, I did a lot of rehab, which was hands-on, and obviously that stopped. So you had to do something. Obviously, online is a really good way to go. So it might have been a blessing in disguise, which is a really odd thing to say about the restrictions, because I don't really think they were particularly handy for anyone. So yeah, it pushed me online a bit more. I do miss the rehab, and I miss the sort of face to face and actually talking to people. I was doing the personal training, training people for face to face. An Olympic javelin thrower comes to mind. So from that level, and also people who couldn't get out of a chair. So everything is in context. So one of my biggest successes, I think, was a woman who literally said, the NHS have given up on me, sitting in a chair, and it was really quite sad. And she said, my world has just gone like this. This is before the restrictions, by the way. She said, stuck in a chair, literally stuck in a chair. Zimmer frame, staggered around the house, shuffled around the house, probably a better word. And by 6, 7 weeks, she was bent over like this. I've got pictures, by the way, if you need them for the channel, but completely bent over. And then she became straight. She was able to walk. Her world opened up, which was really good. And that sort of thing is not possible online, not that to that extent that quickly, because nothing beats seeing somebody face to face. I mean, you've mentioned you've got a back problem. You're quite a distance away from me. If you were very close, I think I'd be able to help you personally, or at least give you a different way of looking at stuff. And that's a disadvantage of online. I'm sure people aren't particularly interested in this nuance, by the way. I don't know if this will stay in the interview, but I think the benefit of the online coaching is the convenience, and you can share screens and you can record it, so you can go back over what was said and check the research and all those sort of things. So there's pluses and minuses to it, but I do feel that we're in the same space. And that's not a problem. I think there's not enough people out there talking about nutrition, talking about health. I know, looking at your logo, you're more into the sort of composition and the bodybuilding and, exercise type of things. But I think, I think you'd agree that you've got to underpin it with really good nutrition. I think nutrition is the key. There's no point in somebody saying, can I speak to the composition consultant? Can I still eat McDonald's? It's like, let's get your nutrition sorted first, because that's going to give you such a big advantage and a push. Your body composition will change without the exercise. If you eating in an incorrect way and then you start to eat in a good way, you're going to see a difference. And then I like to call it the butter on the steak. Once you start exercising, it just takes you to a new level of functionality and that sort of thing.
Yeah, I completely agree. I mean, we know now without a doubt that the amount of energy we expend when we're exercising is pretty trivial in the grand scheme of things. Maybe 10-15% at best. So ultimately, yeah, you're completely right. I mean, your diet is what's going to impact your body composition. And that's then often going to translate into better health outcomes. So you touched a bit on like spinal health and that being something it's your area of expertise. So I wanted to ask, in that regard, what do you see a lot of spine problems happening from, and what are the best ways to reduce back pain in general?
Okay, well, I wouldn't say it's my area of expertise. I think it's just one thing I have been trained in. Let me get my spine. So there's a spine, and it is a fantastic piece of engineering. That's the first thing. And obviously, let's do a spine 101. So the sacrum is like the fused bones at the bottom. It's called the sacrum because they thought it was sacred. They used to think that the soul resided in this area. But obviously, we don't know if that's true. I nearly said obviously it doesn't, but it does. We don't know. And then you've got the vertebrae stacked on top of each other. So you've got like an elevator or a lift, as we say in England properly. But anyway, and in between you have discs. And you have these wonderful formations between each vertebrae where nerves stick out. This is really Spines 101, by the way. And
That's fine, Carol.
It's a springy, reactive column of bone and ligaments and muscles and nerves. And the weight-bearing bit is down here, and there's not much movement deliberately because it's weight-bearing. And by the top, there's lots of rotation and there's lots of movement, and the middle tends to get you to bend from side to side. So the anatomy of it is actually pretty straightforward. The other thing I would like to say is your hip is your base, your second base. So when you're standing, your feet are on the ground and that's a solid base. And then the base for your torso is your hip. And people forget that there's two sort of bases. So when you are working out, one simple thing, and I know you're sitting, I'm standing. If you can stand, it's better to stand than it is to sit.
Because I'm near enough laying down right now, in case you didn't know.
All right. Well, laying is better than sitting, actually. So, so the reason I showed you that is once you get that into your head that you've got these vertebrae and you've got discs in the center of that space there, disc here. What actually happens? Well, you've got this sort of nucleus surrounded by some quite tough tissue, really, and there's no real blood supply to the discs, but they are alive. And what happens is when you move and those vertebrae move up and down, you get this negative and positive pressure and it sucks in nutrients. That's very 101, but that's sort of what happens. So that explains when you're lying down and you're asleep and you first wake up and you're a bit stiff. That's why, because you've not got this movement. And then you'll get up, clean your teeth, and you might feel a bit more fluid. and no pun intended, but there is more movement in those discs. So you plump them up, like plumping up a cushion that you want to be a bit more comfortable. And that's why motion is often the first port of call for me when I'm doing rehab with someone with a bad back, is to try to get them to stand up, to try to get them to move, and actually go into the physiology of what the back's dynamics really are. And that's what it is. So when people have back problems, it does depend on where the problem comes from. So if you have like a traumatic incident, like a car crash, and you fracture your vertebrae, forget what I'm saying at the moment, because that's different. But if you lift a heavy load and you strain your back, for want of a better word, or you just have bad posture, or all of a sudden your back really hurts. One of the things I get told me on a quite regular basis, I was just bending down to get some cereal out of the cupboard and my back went. Well, I can tell you it's not that made your back go. It's years of whatever else you've been doing. So when you start dealing with backs, this is where the hands-on helps, because you can feel around, and I know you can do MRIs and you can do many other sort of techniques to have a look at the back. I think you've actually put on Facebook a couple of your images, which are really interesting about your back. I don't know if you can put them on the screen, but you can see in your back that there is, it's a bit more than just this guy's pulled a muscle. You can see that. That doesn't mean it's beyond help. So I'm now going to say something a bit controversial and you won't want to hear. I will be honest with you though, Jonathan. When I did my training, the tutor said to me, or said to the group, pretty much 100% of back surgery is successful. So I'm going to paraphrase this, because there was a bit in between. And then he said 77% of people who have back surgery come back 3 years later with some referred pain. And I put my hand up and said, well, that to me isn't successful. That's offsetting the problem for a bit, which we had a little bit of an argument about. And so to me, surgery can be a short-term answer. It can really work for people, and I'm not knocking that. If you've had surgery and it's worked, that's great. But surgery can bring with it a different set of problems, because the back, as I say, is meant to be flexible, load bearing, and it has all these different functions. There's lots of nerves in there. And I'm not trying to put you off, by the way. I'm sure you've heard all this. You're a clever guy. I'm sure you researched it. It's not like, yeah, we'll do this and 100% it's going to be fine. So I found it very interesting, and there was an underestimation of sort of rehabilitation and more push towards surgery and medications. And I don't think that's the way. And the reason I say that, and you won't know this about me, and I've got images for this if you want. When I was 23, I'm 58 now, I was told categorically by a doctor, because I'd been taken in with back pain, I was on a stretcher playing squash, which sort of figures. I wasn't overweight. I thought I was eating healthy, skim milk and porridge and freshly squeezed orange juice, and I was a gym rat and all that. Stretchered in, he showed me an image of my hip and said, you will be in a wheelchair by the time you are 50. Not you might be, you will be. And
how old are you now?
58.
Yeah, that's not happened then, is it?
I was playing soccer at 15. See, I've become Americanized. It's actually football, but I deal with so many Americans. I say soccer. So that didn't happen. Why that didn't happen is because when I left hospital after having every sort of procedure you could possibly have and some really great drugs for a bit, it didn't ring true. It didn't ring true to me that was it. That was it for my back. And I was going to be in a wheelchair. It didn't fit. So I went to see a osteopath, and I think it was just serendipity. It was just a guy that was very open-minded, very much into showing me testimonials of success stories. And he got into the sort of manipulation side of things. And I didn't really look back. I mean, once that had happened and I'd had that as a patient, I was really, really interested in it. But I didn't qualify at that point because I was still young and stupid, and I wasn't as interested in health as I am now. I was interested in other things. So I spent a little time, I did stunts for TV shows and quite big films, and I did stand-in work and stuff like this. I was interested in media. I did the Edinburgh Fringe Festival for 6 years running, got into comedy. I did some stand up on TV and all this sort of stuff. All stuff I've never told anyone, Jonathan. So I hope this is interesting to you.
Definitely unique, yeah.
Uh, and then I suffered a little bit of a twinge in my back. And sadly, the guy I'd seen, very long answer. I'm really sorry. It's a bit like talking to Harry, isn't it?
No, nothing's like
I,
talking to Harry.
I hurt my back, and I couldn't find the osteopath I'd before, and I found another one who also was brilliant. So I think I'm quite lucky that I've met two really influential people, and he dealt with football teams and stuff. And I went in and told him about my back and talked about it in a way that he was a bit surprised at. And he treated me, and then that was fine. I went away, came back about 6 weeks later, just sort of talk to him and have a checkup. And he said, "You need to train in this because you know ever such a lot about anatomy. You know, this really would suit you. You can do this." And I hadn't really thought of it. And actually, you know, at this point, I was personal training and doing that, and also sort of like the media type work. So I trained. I trained with two guys who are two of the best in the world. They train all over the world. I think they've been into Manchester City Football Club and Liverpool. I don't think, you know, unless you've got really good credentials, you get into these places. But they were fantastic, absolutely fantastic. Taught me ever such a lot. And I did like the advanced course for the backs and all this sort of stuff. And then you know, obviously once I had the certificate to prove I could do that, I set up in an existing therapy room and had just success after success. I'm not being big-headed. I mean, the whole point of the interview is to talk. And it was all based on some really simple things, some manipulation, spinal manipulation, osteopathic spinal manipulation is the actual term, and the high velocity sort of movement. Telling people like it is. So if there was a problem that was not fixable because of the type of injury it was, or how, you know, when you palpated, you thought this is not going to be helpful, sending them to get an X-ray and MRI. Strangely enough, I got a lot of business from doing that, from not actually charging people, because they'd say, you know, I can particularly remember one woman coming in about her shoulder, and she, you know, I sent her off, and she came back about 6 weeks later and she said, "Everything you said is exactly what the surgeon said," and that you know, she needed an operation. That was from an accident, and I got so much business from that because, you know, I obviously knew my stuff. That's what she said, actually. So I think being straight with people helped. But, you know, I was really surprised. So I did a lot of before and after pictures. There's tons, you know, there was a guy came in literally like this, you know, and within 20 minutes he was straight. I had a guy that had, came in with documents like this, private treatments, all using conventional medicine and medications. Spent about £6,000 on scans and images and all this sort of stuff. Walked in, you know, bent over, really in pain. And then within 3 weeks of the treatment, I got a text. He was windsurfing, you know, and he just said, "You give me my life back." And when I went to charge him, actually, because it was £40 for half an hour, and remember, he'd spent about £6,000 on all these reports and stuff. I said, "Oh, it's £40. Is that okay?" And he went, "Oh, yeah, I'll pay you anything." I nearly said, "Okay, I'll have £6,000 then. That'll be great." So people are really thankful, and it's really nice because all you're doing is just giving a little bit of knowledge and a little bit of guidance, how to manage your back, how to reduce the pain, what the pain is, you know, and how to not ignore pain. We are fed by the mainstream sort of narrative that pain is bad. But actually, if you didn't have pain, you'd really be in a problem because you would not be able to react. So, you know, like a child putting their hand into a fire, if you didn't have pain, they would burn their arm off. I mean, I know that's a silly analogy, but pain you have to listen to. You do have to listen to. And this sort of working through the pain is not good. If you move your arm and there's a pain, it's not like, oh, that will go. So when I say like motion is lotion, it's prescribed motion. So I'll give you a training one, you know, so people come in with shoulder problems and they're doing lateral raises. And sorry if this goes against what you teach people, but that's terrible for shoulders because of the dynamics of the shoulder joint.
It pinches up the joint, yeah.
Exactly. So it's simple things like that. Just saying, well, here's your anatomy. This is why, if you're going to do that, you go that way, really. Because if you really have to do a lateral raise, don't pinch the joint deliberately. And certainly, once you gain a bit of muscle, there's less space. It's good because you've got the muscle you wanted, but it's bad because your joints. And this is where you get the typical steroid, bag of walnuts sort of training body, and you feel like, well, they can't move. Of course, they can't move. Their joints are loaded with muscle. And I'm not saying that's bad, by the way, because I did bodybuilding in my 20s. I did natural shows and all that, and I was absolutely, blown away by people like Dorian Yates. It looked amazing, absolutely. Obviously, a little bit assisted, and admitting that. But I found the whole thing very interesting to learn, and to not just say, right, medicate, dull that pain down, lie down and don't move, which, I mean, when you say it in the cold light of day, that doesn't sound like the best thing to do. I know you're doing that at the moment. I know you're sort of partly joking, but it isn't the best thing long term, because you're trying to return to motion. That's the thing. So it's a bit like somebody saying, I want to be a runner, and me saying, well, whatever you do, don't run. You've got to get to the point where you're getting close to running. So if someone can't run because they can't move, well, what's the first thing? Well, we've got to get you from lying down to sitting. Then we've got to get you from sitting to standing, which sounds dull as dishwater, really. But, that's what it is. I mean, it is a long term. So you get somebody, one of my favourite players was out for, 9 months with a knee injury. Well, that's 9 months with the best care in the world for a multi-million-pound asset. You can't rush the knee repairing. It takes a long time. And I've just done a coaching session today where the person has actually improved their back pain, which is really good, but said to me the rehab exercises are boring. And I just said, yeah, but can you remember how boring the pain was when you couldn't move? Would you call that boring? Like, no, that was agonizing. Right, okay. What do you prefer, boring or agonizing? The rehab is underestimated, and I think a lot of people return from injuries a bit too soon, expect too much too soon, and then re-injure themselves, get a little bit overconfident. So, I had another back pain sufferer came in, and I said, take it easy. Doesn't mean you can't do anything, but take it easy. Don't go stupid. Saw them the next week. I was really surprised because people don't tend to come back. And I said, what did you do? She said, well, I did a bit of DIY, took all the curtains down, did a spring clean, moved some furniture. And it's like, whoa, you went back to your 100% too soon. You have got to let it settle down. That doesn't mean wrap somebody in cotton wool, but you've just got to moderate your rehab, really. So the back is an amazing structure, and it's reliant on many different things. So it's very responsive to motion, definitely. And I think the more you can move it, the better. Obviously, nutrition plays a big part, because going back to the sort of squeezing the joint, if you inflame everywhere, every joint, every space is a little bit smaller. So everything's compressed. And then you get into nerve function, which is then, bleeds into sort of, not bleeds, because that sounds like it's bleeding. What I mean is that crosses over into talking about other things. So, if you're looking at nerve function, then you look at neurological nerve function. You actually look at the hardware of it, like the myelin sheath around the nerves. And you get someone, for instance, I've got a success story. The guy, did an interview because he had MS. When I first spoke to him, or first was aware of him, he could walk across the car park with a cane. He was quite happy about that, but he wanted to get further. Next thing you know, he's in a place like your background shows, lifting kettlebells. You can really progress many different conditions which you're told you can't progress. So it's a bit frustrating for me. And I'll be honest, I've read your story. Sorry, wow, I'm really talking too much here. I've read your story on Facebook. I've looked at the images and stuff like that, and it's like, wow. I mean, that is not the best situation for someone to be in. I can imagine that is quite a lot of pain. But I still feel some of the other ways of looking at it could be beneficial. A little bit of prescribed motion and some manipulation from a partner or something like that. There's things you can do to lower the pain, definitely.
Yeah, so I really glad you went into that in the depth that you did, believe it or not. So for anyone that doesn't know, I've got something called spondylolisthesis and bilateral pars defect and foraminal narrowing, which is basically the pinching that you mentioned earlier. Um, so what it is I'd say maybe 14 years ago, had a rugby accident, illegal tackle. I should take him to court, to be honest. And long story
Mm.
short, that's what happened to my back. And maybe 4 or 5 years ago, I spent several £1,000s on treatments, two chiropractors, scans. I'm trying to think what else now. Loads of physiotherapists, sports massage therapists. So I have
Mhm.
spoken to a few different people. Like when you've spoken to at least two of each kind of area of expertise, you think I've kind of been through the mill now. Obviously, I don't know what you know, so I don't know that what you could tell me would be beneficial. So I'm not going to write that off. But all I will say is the fact that I have to near enough lie down to do these interviews. I've got teary eyes almost because I'm in quite a lot of pain. I'm
Mm.
completely. Anyone knows me knows around about 8 o'clock at night, I take my medication and I'm out. And if I'm online typing to my friends, I'm absolutely off my rocker. It's not a
Mm.
great way of life. So for me, looking at these different options, I've kind of like narrowed it down now. So I've lost a lot of weight, didn't make a difference. I made myself anemic in that circumstance. Um, I done the carnivore diet, reduced my inflammation down to zero. I've ruled it out by means of denomination. So me doing this back surgery, which is about 5 weeks from now, it's not just I've thought, sorry, I'll just leave it to the surgeons to sort out. I've kind of come to this point now where I'm on the last straw kind of thing, and I mean, so many people that are watching this right now will understand and know that they've experienced pain, and like it might not be back pain, but it could be any pain, but
Mm.
that's really going to nullify your life chances. It's going to make things so difficult. I'm really glad that you mentioned that, some of these things can be alleviated. It's not just all take some drugs or do this or do that. Look at things from multiple perspectives and speak to someone like Coach Stephen. He's probably got some ideas that many of us don't know about. So that's something to definitely approach and address. So you touched on diet a little bit. You said how that's such a big player in terms of like pain and health outcomes in general. So, what is your current diet, Stephen, and how do you think that's affected your current health state?
Well, yeah. I mean, I'll come back to I'd like to just pick up on what you said, Jonathan. So you had a trauma injury or crush injury. It's very different. Okay, so if people have been in a motorbike accident, I mean, I had somebody come in completely rebuilt from a motorbike accident. That person's never going to function and move like they used to. That's a fact. But the management of it from then on is there's many different roads and many different ways to do it, and I got him much straighter and moving his arm better, more than anyone else had ever done, because you look at many different things. Nutrition, so I am now answering your question, is part of it. Because if you've got something that is inflaming the signaling or inflaming the muscles, or however you want to look at high levels of insulin inflaming the joints, you're giving an environment that's not particularly good for good health. So I'm a carnivore. I have no lower back issues ever now, as simple as that. Haven't for many years. I deadlift, I squat, do chest press, I do all the main things. I'm currently doing an experiment about how long you maintain muscle for. So I haven't trained for 2 months deliberately, and we're going to do some experiments about muscle mass staying the same, but is I don't actually know the answer, to be honest. I know what the studies say, but I'm interested in my own sort of N=1. So I think carnivore was one of the keys, actually. And if people are switched off, oh, I've got bad back, I don't want to be bothered with carnivore. Well, just low in carbohydrates actually is a big plus. Getting away from anti-nutrients is an even bigger one, in my opinion, because there's no point in avoiding carbohydrates as much as you can, but then saying, well, these plants are okay because they're plants. and they inflame you in a different way, or they suck nutrients out or minerals and all the things you need for like neurotransmission, that sort of thing. So I think the way you eat is really essential. So when you get a pain, for instance, your body, even though you may not even believe this, Jonathan, right now, if you've got a pain, your body is trying to sort it out. And you get what's called ascending and descending pathways. So there's a topographical map in your head, the homunculus, if people like the science. But anyway, and if I get hurt in my arm, what happens is the signal goes up my arm via nerves, obviously, across the spine, up into my spine. And that's where the map comes in. So the map comes in, the frequency of the signal is there, so it tells you what the intensity is. Because, if you're just stroking that arm, it's not pain, but it still sends that sensation. I still know it's there. But so anyway, pain, very nuanced, but that's basically what happens. There's a bit more to it there. So your brain then sends a descending signal down, and it tries to, at the spinal area, tries to modulate that pain, which is why you can have pain, and if it's persistent pain, eventually it starts to nullify. Okay, in the average person, all right? We'll talk about your condition in a minute. But so if you've got some sort of problem, and for instance, you don't believe this happens, and this is why people can lie on a bed of nails. This is why people can undergo sort of like that type of thing, because your body will eventually say that pain isn't that bad. And that happens all the time. So you put a t-shirt on, you're not aware, you don't go around going, I got a t-shirt on, I got a t-shirt on, but it's touching your skin all the time, but the signal is just taken away and you get used to it. Your body just realizes, well, that's not dangerous. So when you've got pain, it realizes that's a problem. So it tries to modulate it until you get to a certain point where it tries to stop you moving. And that's where you come in, you see. So it knows its limitations, and it will immobilize you, and that's the sort of pain, which you possibly relate to. Where you're doing something really innocuous, you don't think it's cleaning your teeth or something, and wow, you're really knocked with pain. Now that doesn't mean that's only people with a crush injury. That is people with postural problems and other issues. But that's pain. That's your body saying, this is so strong, there's nothing I can send. And it's an opioid system, by the way, that the body uses. So there's nothing wrong with the opioids that we make. It's so bad, this person needs to stop. But that doesn't mean that this person needs to then lie down and do nothing for the rest of their life. But it just immobilizes you for a bit, sort of calm down, and you can take stock. And the ascending and descending pathways are really fascinating. So right now, if you moved a bit and you had a bit of pain, your brain would respond with a descending pathway to try and modulate it, make it so it's bearable. And a lot of medications basically tap into that system. They just try to sort of mimic that system, but it's much better when it comes from an endogenous supply, because the body knows better. And this is getting a bit nuanced, and I think you've only got 4 minutes left, but there is more to treatment of backs than just putting yourself in a brace, taking the pain meds, and just stiff upper lip and getting on with it.
Stephen, would you say it's appropriate to use the term use it or lose it?
Yeah, in the main, yes, absolutely. Yeah, because that's true of every part of your body. If you stop thinking, if you stop reading, if you stop walking, just simple things, it gets harder and harder to do it. And the easiest example of that is, and I think this is nice because it's visual and easy to do on screen, if you've got a sling on your arm for 6 weeks, when you take that sling off, all this is withered away, because the body does not want to waste energy keeping that muscle mass there, because you're not doing anything with it. So it immediately sort of breaks it down, and you get this withered arm effect. And what's really interesting about that, or I think it's interesting, hopefully somebody watching will think it's interesting, is if your arm is in a sling and you use your other arm, even that has been shown to retain 25% more muscle on this arm. So you can mitigate all the problems of non-use by doing something. So your back, and um, there may be prescribed movements that you could do that eventually would actually lessen your pain, and it would be really interesting to do that as an experiment, But anyway, you've gone down your route, and I respect you for that. So yeah, you've got to use it. You've got to use everything, and the more you use it, get back into good habits. That would be the best thing.
Perfect. You made some really good points there. I think this is so useful just to anyone. I mean, we all know someone that complains about back pain. That's part of the reason why I didn't get it diagnosed sooner. Because, I've got bad back, my brother's got bad back, my dad's got, everyone's got bad back. I always say to people, if you think it's bad to the point where you're really suffering, get it checked out. A lot of people have severe back issues and they don't even realize it. Um, Obviously, speak to people like Stephen as well. He's going to give you some great advice, and I'm sure even if it's just a video consultation like this sort of thing, it would be very beneficial. So, how can people find you if you want to be found?
Well, I'm happy to give my email out. I'm really not that bothered if I get the wacky email, because most people are pretty straightforward, and that's fine. So I'll give you my email and you can put it on the screen, I guess. Or do you want me to say it?
Say it, go on.
So it's zerocarbcoach@gmail.com. I have a website, the UK Carnivore, not the Carnivore UK, who's also a good guy, by the way, but
Spoke
I'm
to him
the,
recently, yeah.
it's very good, the UK Carnivore. I was first. And I have like I say, a website, obviously. I do some coaching at the Steak and Butter Gangs thing with Bella, brilliant as well. So, yeah, lots of different ways. Instagram, I sort of look at every so often. I'm not very good with Instagram.
Perfect. Thanks very much.